Hello and welcome. Thank you for attending today. My name is Tiffany Kuck, and I am the Population Health Manager at McGowan Brightbender. Today, I'm here to talk to you guys about your outcomes-based wellness program. Our agenda today and the topics we will go over are the following: importance of a primary care physician, also known as a PCP, types of wellness programs, outcomes-based wellness program, importance of a biometric screening and what does it show? What are in-range versus out-of-range numbers on a biometric screening? Participation reminder, score interpretation, and reasonable alternatives. First, what is a primary care physician, PCP? A primary care physician is a doctor that you will go to and make an appointment with to have your annual physical, your annual wellness checkup, just a few terms that you will hear utilized in order to have that screening done. Make sure when you are calling to schedule the appointment that you use those terms, or your once a year annual visit, your free visit. Just so the doctor's office knows to code it properly as a preventive exam. Your annual physical is covered under the ACA Act as a preventive exam, where it should be at no charge to you once a year. A primary care physician is the first step in addressing your healthcare needs, and that's where it starts with an annual physical. There are different types of doctors or PCPs that you can see. There's a family practice, internal medicine, and general practice. Make sure to ask for referrals or from friends and family if you do not have a primary care physician and looking to become a new patient. Also, make sure that they are part of your in-network for your plan. And make sure that you plan ahead. It takes time to get an appointment, especially as a new patient. Important questions to ask your PCP. What can I do to prevent or delay health problems? Should I make any changes to improve my health? Are there tests or screenings I should have based on my age, gender, or different risk factors? Do I need to come back for another visit? Another important piece of your primary care physician annual physical is that there are different types of exams. There's your preventive care exam and your diagnostic care exam. Remember, as you are going for your annual wellness checkup, that is considered a preventive care exam. So this is when you are healthy, you're going to just understand your risk factor numbers, get your blood work done. You're not talking about different bumps and bruises and colds and all different types of other issues that may be going on. As you start to go into those different issues, that's when potentially the visit could be turned into diagnostic care visit. Or if you are going back because you are sick and need a prescription, then that is when it could potentially be a diagnostic care visit. And that's where you may see an additional bill or have a copay. Types of wellness programs. There's a participatory wellness program that is considered just voluntary for individuals. There's no incentive, reward, or surcharge to participating in that program. An activity-based program, that is what General Tool currently has. It is a program where an individual is required to complete an activity, in this standpoint, a biometric screening, to earn the incentive. And then there's an outcomes-based program. And this is what General Tool's wellness program is turning into. That is a program where someone must attain or maintain a specific health outcome. In this case, we will be looking at the biometric screening results. And did you hit an in-range or out of range for 3 of the 5 measurements? What is an outcomes-based wellness program? An outcomes-based wellness program focuses on the early detection and prevention of serious health conditions by identifying those at risk for metabolic syndrome. The risk factors that are determined for metabolic syndrome is glucose, waist circumference, HDL, triglycerides, and blood pressure. So if you have high fasting glucose, high waist circumference, low HDL, elevated triglycerides, or high blood pressure, that is when you start to fall into different risk factor categories. 3 of those out of range considers metabolic syndrome. Now, metabolic syndrome, is not a disease in itself. It is a cluster of risk factors that can cause potential issues in the future. According to American Heart Association, 34% of US adults are estimated to have metabolic syndrome. A biometric screening is a measurement that is used to determine those risk factors for metabolic syndrome. Metabolic syndrome, as I mentioned, is a cluster of risk factors that is tied together. So those risk factors that are measured within the biometric screening: waist circumference, blood pressure, HDL cholesterol, triglycerides, glucose, and A1C if you are currently diagnosed as a diabetic. In range versus out of range risk factor numbers. This is what it will look like on your portal for HealthWorks to determine if you were in range or out of range, earning your credits and not. So for glucose, if your fasting glucose is less than 100 or hemoglobin A1C is less than 5.7, you are in range. If your HDL cholesterol is greater than or equal to 50, then you are in range. If your triglycerides are less than 150, you are in range. If your blood pressure is less than 130 and less than 85, you are in range. And if your waist circumference is less than 35 for female, 40 for males, then you are in range. An employee with metabolic syndrome has a 7 times greater risk of being diagnosed with type 2 diabetes. An employee with metabolic syndrome has a 3 times greater risk of having a cardiac episode. Why participate in the wellness program? You and your spouse, if enrolled in the medical plan, participate in the outcomes-based wellness program because your health is important, because you are preventing serious health condition, and that saves you and the company money. As you share in the cost of the premiums for the medical plan, you save yourself and the company money because the cost of the plan is a direct correlation to the cost of claims. And you can earn a substantial discount on your medical premiums by participating. It's easy to participate. Visit your PCP for your annual physical and blood work by December 15th, 2021. If your spouse is enrolled in the plan and you wish to participate in the wellness program, you and your spouse must both participate in order to receive the premium discount. Have the results sent to HealthWorks. You may review your results in the HealthWorks portal. Along with all of your results, you will see a metabolic syndrome score, 0 out of 5 through 5 out of 5. How to interpret your score. If you score a 3 out of 5, 4 out of 5, or 5 out of 5 on your biometric screening, and if your spouse, if enrolled, also scores one of these numbers, congrats, you qualify for the premium discount. Your discount will start in the 2022 plan year. If you score, same with your spouse, if enrolled, a 0 out of 5, 1 out of 5, or a 2 out of 5, don't worry, you can complete the reasonable alternative standard to earn your premium discount. If you are found to have 3 or more risk factors out of range, you can enroll in and complete the reasonable alternative standard to qualify for your premium discount. General Tools Reasonable Alternative consists of 3 telephonic health coaching sessions. These sessions will be approximately 15 minutes each. Coaching sessions will be available starting September 13th, 2021. You can schedule all 3 calls when you log in, but the calls must be at least 1 week apart. Session 1 will cover the results of your numbers and offer specific recommendations to move your numbers in the right direction. Sessions 2 and 3 will cover what changes you have implemented and if the changes are sustainable for you. If they are not, the coach will continue to work with you to provide ideas and solutions for your specific situation. Note, both you and your spouse, if covered, must either satisfy the 3 out of 5 or greater risk number to successfully complete the reasonable alternative to receive the premium discount. In conclusion, to participate in the wellness program, simply download your wellness visit form from HealthWorks and take it to your appointment with your PCP. The form must be returned to HealthWorks no later than December 15th, 2021. Log into your HealthWorks account to see your results. If you have already completed a physical in 2021 and your results were uploaded to the HealthWorks portal, you will be able to see your score now. If you need to participate in the reasonable alternative standard, register for the coaching sessions on the HealthWorks site and complete each session. Coaching sessions are available starting on 9/13/21. You must sign up for these sessions no later than 2/1/2022. This means register for them, not complete them by. The reasonable alternative standard must be completed no later than 3/15/2022 in order to keep the premium discount. Note, remember, if your spouse is on the plan, the same applies for him or her. If you have any questions, please feel free to reach out to your HR team, or you can contact me, Tiffany Kuck, at McGowan Brabender. Thank you for your time today.